Hi, welcome to Ask a Dentist, a show where we answer questions submitted by users online. I'm your host, Alex, and today we have a special guest. Let's give a warm welcome to a dentist from Taiwan, Priscilla. Hi Priscilla, welcome to the show.
Thanks for inviting me to this session. It's my pleasure to meet you all.
Thank you. It's a pleasure to have you on the show, too. So today, along with Priscilla, we will be discussing the relationship between diet and malocclusion. As of today, there is an increasing number of studies trying to find out the relationship between diet and malocclusion. You may be wondering, hey, what does these two have in common? Well, let's find out together. So, first question, of course, how do we define malocclusion?
It means imperfect positioning of the teeth when the jaws are closed. It could have the following signs. For example, crowding, anterior crossbite and posterior crossbite, or deep bite and open bite in the anterior area, or even malocclusion affecting the growth of the lower facial height.
Now, a lot of mothers, maybe they're outside, maybe they're busy, maybe they're not feeling well. They feed their babies through bottles a lot. So, a good question is prolonged bottle feeding associated to malocclusion?
This is a good question. Many parents have been asking it. The answer is yes. There is a trend toward association of bottle feeding with the need of orthodontic treatment in future. Study also found a trend of increasing need for treatment in future with increasing exposure to bottle. So to conclude, we can use the bottle to feed the child, but the duration should not be too long.
Some mothers, they express that their child is more on the chubby side. Now, the question is there an association between facial height and BMI?
The answer is yes again. Increasing in lower facial height was found in children with obesity. In some studies, there's ascending prevalence of increased facial height length when BMI indicator move from normal to overweight. On the contrary, when BMI goes down, there's a tendency of decrease in facial height.
Some children, they do not like to bite down, they do not like to eat more solid foods. So sometimes the parents give them a lot of soft food. So, will the soft diet during childhood relate to development of dental malpositioning in the future?
Many dental malposition and malocclusion are results from such functional atrophy of the maxillary due to the underdevelopment of the dental arches. Unfortunately, with the modern soft diet, there is now a failing chewing function, and the stress on the growth process are often insufficient. The lack of progressive natural grinding of the permanent teeth, plus the consequent lack of development of an attritional occlusion in the temporary dentition are signs of poorly trained mastication, and it could lead to a bad prognosis for the alignment of the permanent teeth, which we should pay a lot of attention to this kind of problem to prevent future orthodontic treatment.
Thank you, Priscilla, for your wonderful answers. Unfortunately, we only have two more questions left. Some children, they like to eat a lot of candy. They do not like to eat their vegetables. They do not like to eat meat. They don't like to eat anything. So the question is nutritional status associated to crowding in permanent dentition?
Scientific evidence shows that there's no association between malnutrition and crowding in the permanent teeth, but an association was found between low height for age and crowding in the permanent dentition.
Thank you, Priscilla, for your answer. Now, for the final question. What is the relationship between vitamin C and malocclusion?
Vitamin C plays an important role in the growth and the development of the dentition. Vitamin C deficiency will cause disturbed calcification of teeth, retarded eruption, narrow maxilla and short mandible, and high false palate.
Unfortunately, that will be all for today. I would like to thank Priscilla again for coming to our show, and I hope to catch all of you again next week. I'm your host, Alex, and this is Ask a Dentist.